Hello, my name is Kaylin Anders and I go to Nightingale College. I'm going to be giving a video on precautions that a pregnant woman should take. So the first precaution is going to be food. There are a few foods that she should avoid when she's pregnant. So one of them is going to be tuna or any like fish that's high in mercury. This can kind of cause premature births, birth defects, miscarriages, as well as like deli meat. She might want to avoid that, or uncooked meat. There's a chance for listeria, which can actually harm the baby and even cause death sometimes, or miscarriages. It's a harmful parasite. And then she might also want to avoid caffeine. I mean, she can have it in moderation, but it's best to avoid because this can, kind of mess with the baby's heartbeat and just not good if taken in like bulk or, in excess, I guess. Next, we're going to talk about over-the-counter medications. So if she's having pain, she can take acetaminophen, Tylenol. That is safe for pregnant women. But she does want to avoid ibuprofen. This is because it can increase the risk of bleeding, but also it can be harsh on the baby's developing kidneys. So she might want to avoid ibuprofen during pregnancy. It's contraindicated. And then she can use, like, if she has acne, she can use like a topical like benzoyl peroxide, but she will want to avoid retinol. This can cause major birth defects in a fetus. So definitely stay away from retinol. And then she can also take antacids. Those are safe during pregnancy. So no issues there. And then next, I believe, is the environmental exposures that she should stay away from. So first one's going to be secondhand smoke, pretty self-explanatory. This is bad for the baby's developing lungs. It's just bad for the woman overall. She should not be around secondhand smoke. Next is going to be paint. The paint fumes are bad. This can harm the baby's brain. It's bad for the mother's brain cells as well. She should just avoid it at all costs. And then pesticides as well. She'll want to stay away from that. These can all kind of cause like a preterm birth, miscarriage, birth defects, stuff like that. So, yep, she'll want to stay away from those. And then next, I believe, is alcohol, substance abuses, and tobacco. If the mother is drinking alcohol during her pregnancy, this can result in fetal alcohol syndrome. Can also, cause the baby to have like learning and behavior deficits, kind of things like that. If she's smoking tobacco during her pregnancy, this can increase bleeding during pregnancy and after, like while she's delivering as well. Just never good. And then substance abuse. This one's kind of important because the baby can become addicted to the substance and be addicted while it as it's coming out of the birth canal. It's going to be addicted to a substance. So really fussy baby, just not good overall. It'll definitely cause birth defects, preterm labor, miscarriage, all those kinds of things. So definitely not good. And then the next one is going to be travel precautions. So it is okay for a pregnant woman to travel. They do say or recommend that it's best to travel in the second trimester. The first trimester is a little tricky because, there's always that risk for miscarriage and you want to be close to home or close to your hospital or a primary care physician because, in case, they're having a miscarriage, they want to be taken care of and, they don't want to have the risk of bleeding out or something, rare to happen. So, second trimester is good. And then in the third trimester, they say not to. I think this is when you hit about 36 weeks because then you're close to delivering and you do not want to deliver somewhere where you're not at home, not at your hospital. And plus you don't want to give birth on the plane. So just a lot of risks for that kind of thing. And then also there is a risk for blood clots if you're sitting, not moving your legs, blood can pile up. because we do have more blood flow when we're pregnant. So there's a risk for a blood clot if we are sitting too long. So we want to make sure that we're walking, and you can't really do that on a plane. So definitely the risk for that as well. And then if a woman is traveling, she wants to maybe do her research before she gets there and kind of research like where healthcare facilities are, hospitals in the area that she's going to be, because, you know, just in case something were to happen, then she's prepared. And I think the last one is, what is it? Oh, the dentist. So, yes, pregnant women can go to the dentist. They do recommend that they go in their second trimester. This is because first trimester, you know, you're having a lot of morning sickness. You don't really want people to be in your mouth. And then, like, third trimester, you might be too large to, like, you know, recline in the chair, stuff like that. So, second trimester is obviously the best for that. I think they do kind of recommend that they postpone dental procedures until after the woman gives birth, if they're non-emergent. And then x-rays, they will still do x-rays. It's a low enough radiation level that they're still able to do it, but your dentist will probably put extra protection on you, an extra apron, to make sure that they're really protecting the baby. So I think that is it for the precautions. And yeah, thank you so much.